For 34 years, Abby and Brittany lived in one body. They moved together, thought side by side, and were never alone. People watched them grow up, but most did not understand how hard that life really was. Then something happened that nobody expected. A big risk was taken, one that could have ended everything. After the surgery, their lives changed completely. How did they get to that point? What happened during those hours when no one was allowed inside? Keep reading to find out how their shared life changed forever. Abby and Brittany Hensel were born as a very rare kind of conjoined twins called dicephalous parapagus twins. This means they had two heads but shared one body. It is one of the rarest births ever recorded. Doctors and medical students study their case because it shows how the human body can grow in a very unusual way and still work. Their story starts before they were even born. Normally, identical twins grow from one egg that splits into two. Each half becomes a separate baby with its own body. With Abby and Brittany, the egg started to split but stopped in the middle. So instead of two fully separate babies, they grew as two people joined together. They each had their own head, brain, and upper spine, but they shared one lower body. From the chest down, everything was one. Some organs inside were shared, and some belonged to each of them separately. This unusual setup is why doctors thought separation was impossible. Each brain controlled one side of the body. Abby ran the right arm and right leg. Brittany ran the left arm and left leg. They had to learn to work together from the time they were babies just to do basic things like move. They each had their own heart and stomach. But they shared one liver, one set of intestines, one bladder, one reproductive system, and one pair of lungs. Their rib cage and chest were built in a way that kept all of these organs working for both of them. Even though parts of them were separate, they had to work together constantly. Each brain sent signals to its own side, but those signals needed to match up for smooth movement. Walking, sitting, and even just reaching for something required both of them to cooperate. If one side moved and the other did not follow, they would fall. From babyhood, they practiced this without even being taught. Over time, it became second nature. What took effort at first became automatic. Doctors who saw them as babies knew right away how serious their situation was. In many conjoined twin cases, doctors try to separate the twins early if the shared organs are not too deeply connected. But for Abby and Brittany, the shared liver, pelvis, and spinal nerves made separation far too dangerous. The area where their spines joined together was a major problem. The nerves there controlled their legs, bladder, and body balance. Trying to cut through that area could cause paralysis or death. Their shared liver was also risky. The liver has a lot of blood vessels, and splitting it is one of the hardest things a surgeon can do. In their case, one wrong move could cause bleeding that could not be stopped. The shared bladder, intestines, and reproductive system made things even harder. These organs could not just be cut in half and expected to work. Building two complete working systems from one was beyond what medicine could do when they were young. Because of all this, doctors made a clear decision early on. Separation was medically impossible. The risk was simply too great. Instead of trying surgery, doctors focused on helping them live a good, healthy life just as they were. And they did. They learned to walk, write, eat, ride a bike, and even drive a car. Their teamwork made everyday life possible. Doctors kept studying them over the years. Every expert came to the same conclusion. Too many vital systems were shared too deeply. For over 30 years that stayed true. Even as medicine improved, their specific situation remained one of the hardest cases anyone had ever seen. Separation was kept off the table completely, until something changed after 34 years. Separating Abby and Brittany took a level of planning that is rarely seen in medicine. Because of how deeply their organs and nerves were connected, the hospital had to be tightly managed. Only essential staff were allowed in the surgical area. Everything was kept calm, private, and focused. This kind of operation left no room for mistakes. A huge team worked together. Surgeons, anesthesia specialists, nurses, engineers, and medical experts of all kinds. People who specialized in brain surgery, blood vessel surgery, organ rebuilding, and recovery were all involved. No single doctor could have handled it alone. Robotic tools were used because they can move more precisely than human hands. This helped reduce bleeding and allowed delicate tissue to be carefully separated. Computer systems using artificial intelligence helped map out the nerve pathways before and during surgery. These systems showed exactly where nerves were connected and how signals traveled. This was critical because the twins' lower spinal nerves were tightly joined. One wrong cut could have caused permanent paralysis. By mapping everything first, surgeons could plan every move before making a single cut. The first part of the operation focused on separating shared blood vessels in the chest and stomach area. Both bodies needed stable blood flow, so surgeons had to build new pathways for each twin. Special clamps and tubes kept blood moving safely while this was being done. Next came the spinal area, the most dangerous part of all. The two upper spines merged together lower down near the pelvis. Surgeons carefully separated the nerve bundles while machines monitored brain activity, muscle movement, and reflex responses every second. The room was nearly silent except for equipment sounds and short, quiet instructions. Then a crisis hit. Abby's heart stopped. Team moved fast. Heart specialists worked to restart it while others kept Brittany stable. Just a few minutes of delay could have ended everything. Fortunately, her heart started again, and the surgery continued. The next stage was rebuilding organs. Because they shared a liver, intestines, bladder, and reproductive system, each twin now needed her own. The liver was carefully divided so both sides kept enough tissue to function. Where natural tissue was not enough, artificial materials were used. These materials are safe for the body and help healing happen over time. Both twins were kept breathing and stable throughout. Blood pressure, oxygen levels, and nerve responses were watched constantly. Staff rotated so no one got too tired, but the plan stayed on track. Slowly, what had been one connected lower body began to look like two. Muscles were separated and reattached. Skin grafting was prepared. Where the body's own tissue was not enough, synthetic layers were added. Rebuilding was just as important as separating. The final stage dealt with the pelvis and legs. Bones were divided and new support structures were built so each twin could have an independent lower body. When it was finally done, two patients lay on two separate tables for the very first time. Doctors checked vital signs again and again. Both bodies were breathing, circulating blood, and responding to nerve signals on their own. After the surgical sites were closed, both twins were moved to recovery rooms. The surgery had worked, but no one knew yet how their minds and bodies would handle the change. Surviving was only the first step. The weeks after surgery were harder than most people expected. For the first month, neither Abby nor Brittany could move without help. Their muscles were weak from the long operation. Their nerves had to relearn how to control a body that no longer needed to share control with another person. Simple things like sitting up, turning the head, or lifting an arm took real effort. Nurses and therapists stayed nearby at all times. The emotional pain was just as real as the physical pain. Their whole lives, they had felt the constant presence of the other person. Now there was empty space. Felt like part of them was gone. Their brains needed time to adjust. To help, mirrors were placed in their rooms so they could see a familiar face when they looked up. Therapists also brought in familiar sounds and routines from their past to make everything feel a little less strange. After 6 weeks, they were finally allowed to see each other in person. It was the first time they had ever looked at each other as two completely separate people. The moment was quiet and emotional. They reached out and held hands. After that meeting, physical therapy became more intense. They practiced sitting on their own, then standing with braces. Learning to walk was painful. Their muscles and nerves were building new patterns from scratch, and every step required a kind of balance they had never needed before. To stay connected at night, a video screen was set up in each of their rooms. They could see each other whenever they wanted. This small thing helped reduce fear and made sleeping easier. Slowly, their confidence grew. Month by month, they got better at holding things, turning, sitting comfortably, and lying down alone. Their therapists walked them through every small action with patience. By the end of the year, they reached a huge milestone. On the 1st of January, Both of them walked across a room without any help. It was proof that their bodies were truly adapting. They kept working on strength, balance, and independence. They tracked their progress over time. Every small win made them more confident. When they finally left the hospital, a whole new kind of challenge was waiting, figuring out how to live in a world that no longer matched the life they had always known. Abby and Brittany had always needed to work together for everything. Shared routines, shared space, shared choices, that was just life for them. As they got older, this closeness shaped not just their bodies but their emotions and family relationships too. Any change in one sister's life directly affected the other. A big turning point came when Abby married Josh Bowling in 2021. It was a real, legal, documented marriage. Photos shared publicly confirmed it happened. But it created a situation that no one, not family, not lawyers, had ever had to deal with before. Legally, Abby was the wife. Her name was on the marriage certificate. Brittany was not legally part of the marriage, even though she shared the same body and the same daily life. For the first time, an official document treated one sister differently from the other. Josh knew from the start that marrying Abby meant Brittany would always be present. Living together required respect, patience, and emotional awareness from everyone. For Brittany, this was a quiet but real identity struggle. She had always been an equal part of every decision. Now a major life event belonged mainly to her sister. She stayed supportive and present in daily life, but the emotional weight of marriage was mostly on Abby's side. Their parents had to adjust too. They had always raised and thought of their daughters as one unit. Now they had to make room for Abby's new role while still treating both daughters with equal love and care. It was not easy and took time and honest conversations. Their younger sister Morgan also found it hard. She had grown up seeing Abby and Brittany as a team. Watching Abby move into a new chapter that did not fully include Brittany felt strange. Morgan had to accept that adulthood would look different for each sister. There was some tension, but also real growth as the family talked things through. The family eventually got help from counselors. Therapy gave everyone a space to talk about feelings that were hard to put into words: confusion, sadness, and hope. It helped the family find a new way forward without drifting apart. Over time, Abby's married life found its rhythm. She kept working as a teacher. Her husband became part of the household. Brittany shared that same space but worked through her emotions on her own. Public curiosity made everything more intense. People kept asking personal questions about how their marriage worked. The sisters chose privacy over explanations. They protected their peace. For Brittany, it was sometimes a lonely feeling, being fully present but watching her sister step into something that felt more distant for her. It did not cause fights between them, but it did cause deep personal reflection. Their bond stayed strong, but their individual identities were growing clearer. Even in a shared body, each person had her own inner life and her own path. While Abby settled into married life, Brittany focused more on herself. They had always had different personalities, different likes, and different ideas. Even in one body. This time in life gave Brittany more room to explore who she was. She had always been interested in science and health and how the body works. She got involved in education and awareness work related to medicine and rare conditions. She worked with organizations that supported conjoined twins and their families. This work gave her something that felt truly her own. She started traveling more for speaking events and awareness programs. She met new people, visited new places, and found new ideas. It gave her a way to express herself beyond the daily home routine. During this time, she met a man named Ryan who shared her love of science and learning. Their friendship grew slowly through real conversations and shared curiosity. Ryan saw her as her own person, not just one half of a pair. That meant a lot to Brittany. She also began making bolder fashion choices. Abby had always loved bright colors, especially red. Brittany started choosing darker colors and different styles. It may seem like a small thing, but for them, it was a real sign of growing independence. Clothing became a quiet way of showing who she was. Shopping for her own style gave her a feeling of control that was sometimes hard to find in a shared body. These small choices added up to a stronger sense of self. She still could not make every decision alone, but she got better at speaking up about what she wanted. This made their communication stronger and their understanding of each other deeper. Even as their lives moved in different directions, they stayed emotionally close. Every night they talked and shared their day. Brittany's growth did not pull them apart. It actually showed that two people can be united and still be individuals at the same time. She was building her own life while still honoring what she shared with Abby. Then, just when it seemed like things had settled, news came that surprised everyone. When news of Brittany's pregnancy got out, it surprised both the public and the medical community. Most people had always assumed that because Abby and Brittany shared a reproductive system, an independent pregnancy would be unlikely or very complicated. As dicephalous parapagus twins, they shared one set of lower organs, including their reproductive organs. This topic had rarely been talked about openly. When the news started spreading, many people simply did not believe it. Doctors knew that shared anatomy in conjoined twins can differ from case to case, but a pregnancy in this situation was extremely rare. For years, this part of their biology had only been discussed quietly in medical settings. Medical professionals responded with careful curiosity. A pregnancy like this would need very close monitoring because of the unusual body structure involved. Blood flow, organ function, and physical balance would all need to be watched carefully. Doctors dealing with pregnancy would face questions that do not come up in any normal pregnancy. News spread fast across media and social media. Many people were amazed. Others had concerns about safety. Most of the public simply did not know enough about how Abby and Brittany's body actually worked. Brittany chose to stay quiet and let medical professionals manage the information. Abby was fully supportive throughout. Their bond stayed steady even as public attention grew. Abby stayed close to Brittany through regular check-ins and visits. The news also attracted the attention of filmmakers and producers. A documentary series that had been planned about their lives was expanded to include this new chapter. The goal was to let them tell their own story instead of letting rumors fill the gaps. Some moments were filmed under strict privacy rules. Around the same time, Abby was also thinking about a medical procedure of her own, facial reconstruction surgery. Because they share so many features, Abby wanted changes that would help people recognize her more easily as her own person. Both sisters were finding their own ways to grow individually. The pregnancy also pushed them to speak more openly about supporting other families with conjoined twins. They knew how rare and confusing their situation was. Together they began building plans for a foundation that would fund medical research, provide education, and offer financial help to families in similar situations. The foundation aimed to give families real, honest information and long-term support. They had lived through things most people never experience, and they wanted other families to feel less alone. As the pregnancy continued, doctors monitored everything carefully. Every checkup added to medical knowledge because cases like this are so rare. It stayed private, but its impact reached far. For Brittany, it was an emotional time full of both joy and pressure. She focused on rest, health, and staying calm. Family support made a real difference. Abby's presence through it all showed just how strong their bond truly was. For most of their lives, Abby and Brittany had a body that worked in a way almost no one else could understand. From the outside it looked unusual, but inside it was a well-organized system that kept two people alive in one body. Doctors studied them for years because their case showed how the human body can adapt to rare situations and still function. They were dicephalous parapagus twins, 2 heads, 2 brains, 1 shared lower body. Their upper bodies were mostly separate, but from the chest down, everything worked together to support both of them. They each had a heart. Those 2 hearts beat inside one chest, and blood flowed through shared vessels that fed both brains and the rest of the body. This balance had to be maintained all the time. If blood pressure shifted for one, it could affect the other. Their bodies learned to manage this on their own as they grew. They each had a stomach and could feel hunger separately. But food from both stomachs went into the same digestive system below. They shared 1 liver, 1 set of intestines, 1 bladder, and 1 reproductive system. All digestion, waste removal, and hormones ran through one shared pathway for both of them. Their nervous system was even more complicated. Each brain ran one side of the body. Abby ran the right arm and leg. Brittany ran the left arm and leg. Their spinal cords started separately at the neck but merged together as they went down toward the pelvis. Nerve signals from both brains had to pass through the same connected areas. Even something as simple as walking required both brains to agree at the same moment. If one leg moved and the other did not respond, they would fall. From childhood they practiced this without being taught. Just became part of how they lived. They learned to move together without thinking about it. Their brains built a natural rhythm. They did not need to talk before taking a step. Their nervous systems worked so smoothly together that most people forgot how much coordination it actually required. The pelvis was one of the biggest reasons surgeons believed separation was not possible. Their spinal cords merged into one nerve network there. Those nerves controlled the legs, bladder, bowel, and body stability. Cutting through that area without causing permanent damage was seen as nearly impossible. The shared liver was another major danger. It had many blood vessels running through it, and dividing it into two functioning halves requires extreme precision. In their case, one mistake could cause serious and uncontrollable bleeding. The shared reproductive system was also deeply connected to blood supply and nerves. Separating it would mean building two complete systems from one, something medicine could not do for a very long time. Doctors were always clear about the dangers. They warned of paralysis from nerve damage, brain damage from sudden blood flow changes, and death from organ failure or infection after surgery. These were not small risks. They were serious enough to stop any discussion of separation for decades. Since Abby and Brittany were healthy and living full lives, surgeons saw no reason to risk their lives with such a dangerous operation. Keeping them as they were was the responsible choice. Over time, better imaging technology, robotic tools, and nerve mapping improved what doctors could do. But their case stayed one of the hardest ever studied. Many experts believed separation would never be possible in their lifetime. For more than 30 years,